All right, we'll go ahead and get started. So I want to again thank you everyone for being here today. The goal of this workshop is to help you spread the word about radon's harmful health effects and what can be done to prevent radon exposure. My name is Tyler Kottner. I'm a program manager at the Environmental Finance Center. I'm joined by Leslie Kimball, who is our marketing and communication specialist at the Environmental Finance Center. We have been partnered with EPA to provide this outreach and develop a social media and communications toolkit for you. And we have also partnered with K-State's Radon Program, who have been providing national radon training, outreach, and services to the public since 1988 through contact with the US EPA. Christina Snyder has been with the program since 2011 and currently serves as the Associate Director of Radon Programs. Stephanie Limekuhl joined in 2018 and works as the Program Coordinator. Both organize, design, and use social media for National Radon Action Month as part of KSU's Radon Program's outreach plan. Today, we'll be sharing some radon communication strategies as well as the toolkit that we have created to help with radon outreach. First, KSU is going to give us an overview on radon.
Ooh, that's me. And I actually recognize almost half of you. So I thought, since we're a really tiny group, if it's all right with you, Tyler, I thought I would have them go by and tell us who they are so that we know how much radon information they may already have. So I will start with Leanna.
Hello, good afternoon. I'm Leanne Norquist. I'm with the State of Nebraska Radon Program. And I have been here, I don't know, for 5 years now. And my radon experience goes back almost 20 years.
Excellent. And how about Adrian?
I'm Adrian Moody. I am the new program manager for radon and indoor air quality for the state of Nebraska. Yay, yes, I am very brand new. I just started in October, so I'm diving feet first into everything and just ready to learn more about radon.
Excellent. And we'll do Randy next.
I don't know if my microphone's working. Randy Lane with the Iowa Department of Public Health. I manage the radon program.
Excellent. He's been around for a while too. And how about Angel Dale?
Hi, I'm Angel Dale from Four Corners Health Department in Nebraska. And I manage the radon program and have for probably 4 or 5 years here at the health department.
Excellent. Welcome. And Joyce?
Good afternoon. My name is Joyce Thayard. I'm with St. Louis County Department of Public Health, where I manage the Healthy Homes program. And we were a recipient of the HUD Healthy Homes Production Grant, where we have to do radon testing for about 60 homes. So I'm here to learn more about communicating those results to our clients.
Excellent. Welcome. How about Caroline?
Yeah, hi everyone. My name is Caroline Powell. I'm with the Iowa Cancer Consortium. Been with them for about a year, and I help out with the radon work group.
Excellent. Lauren? All right, we'll skip ahead. Oh, there you go. Hey.
Oh, hi. Sorry. My name is Lauren Pye. I work with Joyce at the St. Louis County Department of Public Health. And I work with her on the Healthy Homes Production Grant.
Excellent. Welcome. How about Lily?
Hi, I am with the Loop Basin Health Department here in Burwell. And I just got handed over radon. So I am pretty new with this.
And what state are you?
Nebraska.
Okay. Excellent. Welcome. And last on my list is Robert. Can you give us just a brief introduction to you? So we're a real small group today. We just figured we'd learn who we're talking to. I see that you're unmuted, but I cannot hear you. We were having some trouble with Leslie this morning too. So if you have access and you want to put it in the chat, that would be fine too. All right. Well, welcome everybody. We're glad to have you. I see we have a extreme ends of mixtures, as many of you here who are new, as you are who have been here for a number of years. So we're going to start with a really quick 10-minute version of why we're talking about radon in the first place. All of you have either been assigned or come to radon by some format or another. We are never any of us wake up and decide we're going to go to school for radon. So we welcome you all from whatever backgrounds you come to. So that's what I'm going to do next is a brief overview, and then we'll turn it over to Leslie to talk about the resources we put together for social media outreach. And we really mean it to be a workshop. It's definitely not many. There are not many of us, and therefore we can literally workshop stuff for you individually, because I think we're going to have time for that. So let me quick run through why it is that we're talking about radon in the first place, why we have Radon Action Month, and why we want to get that information out in front of as many eyeballs as we can. All right. So this is our 10-minute version. Adrian is going to join us next week for our full 16-hour measurement training. If you're doing the professional end, that's the end that's where we go. That's the extreme lengthy end. This is the 10-minute extreme shortly end. Excuse me. So, is it not? Click. There we go. So we're going to start with some basic information. We're going to talk about what radon is. So this is, as you all probably know, it's a naturally occurring inert radioactive soil gas. There is no way for you to sense it, but it does, because it's airborne. It does travel through the soil, through the little tiny pockets of air in the soil, and it comes up into every building on the planet. There are no buildings that have no radon, right? It's invisible, odorless, tasteless, inert. And it's radioactive, which is the thing that makes us care about it. The only way to know, because we can't sense it, is to test. So we always start with the testing side, because we don't know if there's a problem or if there's elevated levels that we need to deal with until we've run a test. Every state has had elevated indoor levels. I would venture to guess that every one of your counties has an elevated level report somewhere. We've been collecting reports at the states in Region 7 for many years, decades, actually. The other number that is important is the EPA action level, which is 4 picocuries per liter of air, which is a measure of radioactivity. Any building that tests to that level or higher is recommended to be mitigated to reduce those exposures for the occupants. So here's a picture diagram of how this works. We're on planet Earth. The planet Earth has uranium in its crust. We can't get away from that. That source is never going away, not in many of our lifetimes. As that uranium breaks down, it becomes radium, which is also a mineral, so it stays where it is, like the uranium, in the Earth's crust. And then when the radium radioactively decays, it becomes radon. And once it's radon, it's a gas instead of a rock. And now that it's a gas, it can move up through the ground and make its way into our buildings. The average indoor US level is about 1.3. We live in a section of the country where the averages are much higher in many of your states. Iowa, you win the lottery. I think something close to 75% of the houses in Iowa test over the EPA action level of 4. I think Nebraska is not far behind. In Kansas, it's about 1 in 3 houses based on the test reports that we have. And I should have looked up Missouri, because I don't know what Missouri's levels are, but it's not far off because of the geology and the way we build houses and various other things here in this part of the country. Soil tests can't really be predictive, because the soil levels can be in the hundreds, they can be in the single digits, they can be in the hundreds of thousands, and you build the house and you test the house and it may still be low. So it's always a thing that you have to test in the air in the home. And I guess here is a good place to say we start in the home, because by and large people spend the most of their percentage of their day in their house. Most of that time you're asleep. And so you forget that you've spent those 12 hours of sleeping in your house. But as a percentage of your lifetime experience, a good chunk and most of your time will be in the house. And that's why we test there. It is the biggest piece of your exposure. Like I said, it's in all buildings, so you are also getting some exposure wherever it is that you work or where your kids go to school or any of those other things. But the biggest chunk of the exposure is in our homes. And so that's why we test there. It is the #1 cause of lung cancer. So that's the issue. We've got radon. We figured out why how it comes up into the house. It comes into the house, and then why do we care? We care because it increases your baseline risk of lung cancer. It is responsible for an estimated 20,000-ish. I think the range is 20 to 25,000 deaths a year in the U.S. And it is the leading cause of cancer death. It says as of 2020, but that's been true for a long time. Then if you are a never smoker or a smoker who smoked a long time ago for a short period of time, then this is almost certainly the cause of your lung cancer should you develop it. This is also true because lung cancer tends to be an end-of-life disease. If you develop lung cancer as a young person, it is likely that radon is a big contributing factor of that process also. So obviously our risk depends on how much we're exposed. This is a dose thing, right? So how much we're exposed and for how long you're exposed there. But this is also a cancer development. So there are some other genetic factors that are going to come into account. People who have a history of cancer in the family have, I believe, a 40% increased risk with the same exposure to radon. So those things also come into play. And then obviously your smoking history. If you are an ever smoker, especially at certain levels of packs per day, per year, etc., those activities are also doing the kind of damage that can increase lung cancer, which we know now is well established. However, I looked up your smoking rates in Region 7. Kansas is about 17%. This is adults. This is not under 18. Missouri is about 19%. Iowa is 17%. Nebraska is about 16%, according to the American Lung Cancer Association. So that means like 85% of people in the region don't smoke. And so they don't have that increased risk for smoking. So most people with lung cancer at this point, especially if they're under, I don't know, roughly 50, 60, somewhere in there, where when we stopped smoking in the 80s, and we've done a really good job of getting everybody most folks to quit, their exposure that is causing lung cancer is radon. It's not smoking anymore. And so there's a good movement around the no stigma movement, because the first question anybody with lung cancer is asked is how long they smoked, even though 85% of them have never. So this is some of the information. Move your pictures over. There you go. So it is certainly possible for radon to cause lung cancers below EPA's action level. There are some research work that has been done that show like they average it to about 12% increase over 20 years at 2.7 picocuries per liter of air of exposure of your baseline level. Your baseline level is about 2% if you're a never smoker with no history of lung cancer in the family, but that multiplicatively increases again if you have a history of cancer in the family, if you're a smoker or never smoker, or you've had other exposures that are increasing your baseline risk. In fact, most radon-induced lung cancers actually occur below the action level. The action level is where it is, however, and so we literally will take an act of Congress to change that. So that's not going anywhere. But that just means that it's still really important, imperative that we do the testing and the mitigation on that end. Just as a general note, radon is by far your greatest single source of radiation exposure. It's the big red pie piece here. If you were to add all medical exposures at this point, medical exposures would be larger. That's your CAT scans and that sort of x-rays and whatever else you might need to have over your lifetime. But because radon is constant and it's in all the buildings, it is your biggest section. And this assumes that your exposure is 1.3 picocuries, which is the indoor average. And as we've discussed, in a lot of houses in this region, that isn't your exposure. Your exposure is higher than that. So radon is airborne. It comes into the houses, then it itself radioactively decays and breaks down. those pieces, the radon itself is inert, meaning it doesn't stick to anything, but once it has broken down radioactively, they become sticky, or you can think of them as sticky. Those sticky things either stay in the air or they stick to something else, like a wall or a ceiling fan or your desk or whatever, and then they go through their radioactive decay cycle and become non-bothersome, at least in a health fashion at that point. If they're still airborne and you breathe them in and then they radioactively decay, that's where we do the damage that we're concerned about that increases lung cancer risk. So that process of radioactively decaying can damage the DNA in your lungs. It's the only place in your body where it is touching live cells in a way that can damage the DNA, and it can physically break or it can chemically alter your DNA. That happens. Again, we're on planet Earth. Our bodies know this and do this all the time. So most of the time, those cells will die or they will fix themselves because that's what our bodies do for it. Or it may not, and it may stay mutated. And it's that section where it stays mutated, which is what increases the risk for becoming cancerous down the line. So here's some demonstrations of the alpha particles, these little bright red spots that flew across the screen there. This is the damage that physically happens in the DNA that then can increase your risk for lung cancer. So how do we know this is what's going on? A number of things. We've been talking about it worldwide since at least the 50s. In Sweden, they started with looking at miners, people who dig things out from underground, not young people, because they were wearing radiological tracking devices as they went to do things like mine uranium. And they could determine from thousands upon thousands of those research data points that this was an increase that was significant for those miners, that the radon itself was what's making, separate from smoking, was making additional exposure. So then they thought, well, okay, that's fine, but what about regular people? Because we know how uranium radioactively decays. We know it becomes radon. We know radon is airborne. So they did a study between 93 and 97 where they took 1,000 Iowans, roughly, who were a third of which were newly diagnosed, or 40%, I guess, were newly diagnosed with lung cancer, and 60% were not. They were looking at women in particular because women generally spent more time in the home, especially at this time in the world. Those folks were typically homemakers, so they were spending like 100% of their time at home instead of whatever 18 of 24 hours, right? And they only selected women. It must have taken forever to select enough women who had lived in the same house and had a radon test in that house so that they knew what that exposure was over those decades, for 20 years or more. And they made sure that their sample included smokers and non-smokers, and they looked at this set of people, and they found that there's a significant link between radon dosage and lung cancer risk in the home, specific, like separate from minor exposures, which are clearly different if you're down there digging in the rock that's creating the radon. So when they had been exposed for the EPA's action level of 4 picocuries over the period of about 15 years, they had increased their risk of radon of lung cancer by 50%. So this is the research that indicates that this is what we're concerned about it in the homes in the same way that we would be concerned about it for minors. They have also done some research studies that pool similar kinds of things in Europe and in other parts of North America. Yes, this is the lung cancer incidence. You can see that we are tied here with leukemia for the number of cancer deaths separated out from lung and bronchus. Lung and bronchus is typically, this is the number that we give for smoking-induced lung cancers. All right, so the other thing that we talk about and we like to put to the forefront, especially in social media outreaches, is that if you're a smoker and you have high radon, you are multiplying your risk. So if you have decided to stop smoking and you can also lower levels of radon in the home, you are actually getting a multiplicative decrease in your risk over the rest of your lifetime. So smokers are about somewhere between like 9 and 11-ish times. They have 9 to 11 times more risk associated with being exposed at the same levels of radon. And smoking has the carcinogens that we know about that are also many carcinogens that are also increasing your lung cancer risk. So, excuse me. So this is something that we're trying to push to the forefront, especially in the medical settings. If you've got somebody who's already looking at quitting smoking, then reducing radon can be an extra benefit for them too. So why is it so hard? Why do we have to keep talking about this many, many times? Well, because it's naturally occurring. There's nobody to sue about this, because the incidents and the drawbacks and the damage you may have comes from has a very long latency period, right? We're talking about the lifetime of you typically before you have developed lung cancer from radon. And it's technically voluntary because you can fix houses. Now, that's not entirely true in an environmental justice sort of sense, but it can be fixed, which is the important bit out of that list. So why does it come up into our houses? Well, if we have a strong source in the soil, it's easy for it to move through the radon, through the air. It will find the connections between the soil and your house. And then every of our houses suck. So there are all kinds of ways for little amounts of air, and we don't need a whole lot of air to move radon because we're talking about individual molecules when we're talking about radon gas. So it will be pulled up into the house because through all the tiny little cracks, and every time a plumbing penetration happens, the ground's settling, the concrete doing it what's supposed to do and cracking along the floor to wall join. So there's all kinds of stuff that we see and we can't see that make a connection between the soil and the house. And when we heat, especially when we heat our houses in the winter and the temperature differential is very large from outside to inside, like it has been in the last week or so, our houses suck. They're pulling like a vacuum on the ground, and they're encouraging the little tiny molecules of radon to come up through all of those available cracks in our house. So we expect pressure differentials from the inside to the outside of the house to change with temperature, with weather, with turning on your giant downdraft range hood. All of those things change enough of the aerodynamics of your house to increase or decrease, depending on what you're doing, the radon levels in your home. So this is why we take radon measurements over the course of a couple of days so that you can see the changes that we expect to happen as the temperature changes outside and the temperature changes inside in our house, or we use fans, or we open and close doors and windows, and all of those things that we do while we occupy our homes. And then we always get this question, but what if my house is drafty? Well, your house is still sucking on the soil. And if it's drafty in some ways, it may be increasing radon levels. And if it's drafty in other ways, it may be decreasing radon levels. There is no correlation between the draftiness of your home and the level of radon. If there's a strong enough source of radon, it doesn't matter how much air you're flowing through your house, you're still going to have a house that tests high. So you cannot predict radon levels. You can't, because of the way you heat and cool it, because of how it touches the ground, how old it is, how tight it is, what shape it is, whether you've got a sump or a crack that you can see, or any of those things. You just have to test. So we test, we fix. I should have changed that. You should have a Kansas certified, a Nebraska certified, or an Iowa certified, because your 3 states require certification to do this work for pay. And in Missouri, we recommend you use somebody who is nationally certified. Same reasons. Okay, so how long does it take? Well, as you all know, short term is most of what we do, but there are also 90-day exposure. 91 days is a long-term test. 94% of the time, the short-term test is going to give you the same mitigation decision as the long-term test. So the short-term test is where you start. It's the easiest. It's the fastest. You get your answer fast, quicker. Test location depends on the purpose. If you're in real estate, you're testing in a place that is the lowest that somebody else might live in, regardless of whether the current occupant lives in it. As a non-real estate, you test the lowest level you spend time in. And probably from what you are saying, most of you all will be testing in the lowest lived in house determined by the occupant. Here's where we test and don't test. We do not test in kitchens, garages, bathrooms, laundry rooms. The mechanicals room usually is most of the time is okay unless the laundry is in there also. And that is because the way that our test devices work can be influenced by the moisture in those places. And because what we're trying to do is estimate your exposure or your occupant's exposure, we want to test where somebody's face is, right? So here's what these testing devices look like. Top right corner is charcoal varieties. Then there are some electrets, the ones that say ePerm on them, and then the rest of them are electronic devices that are, except the rad track, I guess, that are continuous monitors of the kind that you'll probably see in a real estate transaction. So once we've put the testing out, we do rocket science. Oh, it's not rocket science. It's more like vacuuming science. So the way we fix it is by pulling the air that we know is coming up underground with radon in it and venting it above the roof. It is by itself caulking and sealing, even though we talk a lot about cracks and that's how it gets in there. By itself, the sealing is not going to lower levels of radon, but as a part of a active soil depressurization and vacuuming system, it is essential because it keeps you from pulling indoor air back into the system and short-circuiting your attempt to remove the radon from under the house. So we got some pictures of how it looks. This works. This works. It works in almost all houses. This can be done. There are no black and whites. There are no hard yeses and nos, but this is always where we start when we try to fix it. Okay, so here's the way it looks in an attic on the left, and the way it looks if you run it on the outside on the right, and then up the top left corner is the indicator that everybody thinks is telling you what the radon level is, but it's actually telling you that the system is on. Because again, we can't sense radon, and this little tube full of mineral oil is also not going to tell you what your radon level is. But that's what we're looking at. And here's what it looks like on the graph, right? So the maroon line that goes up and down and up and down and up and down is the radon levels from one of those continuous radon monitors. The green line is what happened after they installed the system. And where the maroon line takes a nosedive from somewhere just about 8 and goes down to somewhere just about 1 is when they turned the radon system on. So these things work. Vacuuming radon from under your house is the best and the most consistent fix that we have. So that's my 10-minute really fast spiel. And now, who are these guys? Well, we are K-State. We have radon programs here, including the National Radon Program. We also operate the Kansas Radon Program out of our office. We do training, and we run one of the only secondary radon chambers in the country, which is something that the professionals use to make sure that their equipment is doing good science within tolerance. So here's us. I think many of you've got emails from a good chunk. We emailed you, so I think some of you are on my list. If you're in Kansas, we do have a healthcare providers 2-hour Kansas train course that exists. This is the information. We can get that out to you specifically if that's your jam. We also, if you would like, we can explore putting something similar together in the other, taking that same content and making it specific for the other 3 states. And that is it. That's my fast overview for people who know a lot and not very much at the same time. Do we have any particular questions? Anything I've missed?
I have a question that I get when I'm like doing outreach tables a lot. So if it's like outside of the scope or anything like that, let me know. But people always ask me, so if somebody gets lung cancer, like apart from, you know, that they were a never smoker and then testing their house for radon, like, is there some other test that doctors do to decide or to tell that the lung cancer was from radon, or do we know it just statistically?
So mostly we know it by statistics, but there are actually, they have developed like a DNA level view that they can see that the damage done by the alphas of a radon decay cycle are different than the ones it's not a commercially available test, right? But if you look at the Huntsman Institute in Utah, I'm blanking on his name, but the doctor that, I don't know if he's still there, but I think so, that runs the Huntsman Institute has done that research. So you can see it at a molecular level, but we do not have the real ability to molecularly eyeball every cancer. So it's statistics that tell us that at this point. Functionally, like in the office, right? And Denise, did you have a question?
Yes, please. And I apologize. I joined in late, so I don't know if this was addressed or if this is the right venue to ask this. But how effective is it to use an existing flood mitigation system within a home, like with pumps, etc., to do radon mitigation?
Right, to use a water
I have,
removal system?
yes, I have for my own personal, so for like friends, neighbors, they ask how effective is it not to install not to need to install a separate system.
So that seems to be a preference issue, and a lot of radon answers are all gray material and no black and white, right? So it can be effective, and there are people, professionals who prefer to do it that way. If the water removal system is not always full, right? If you've got a sump that runs 100% of the time and those pipes are full with water, you don't have any airspace to pull under. And so it's not going to be an effective way to remove the radon that we need out of the airspace. If it runs occasionally or hardly ever at all, and you have that French drain, it can be a very effective way to pull air from the entire footprint of the house, right? And we get better results if we can remove the soil gas from under the entire house. And so having that perforated pipe down there can be really effective. You do need to do some things, especially by standard as a certified professional, which you are required to be in 3 of 4 states here, and that we recommend you use in Missouri anyway. You are going to have to do some specific types of connection to the top of that sump lid so that when the sump system needs repairing, you don't break the radon system and never put it back together. So there do have to be some additional things that have to be done so that one can do the rest of the stuff. And we never want to install a radon system that breaks a water removal system. So it can be challenging to get the engineering right, but it's always engineerable. In almost all cases to have a radon system installed, even if you have water removal needs.
Thank you. Appreciate it. Thank you so much.
All right. Well, that's our basics. I'm going to pass you on to Leslie, who will talk about what we have set up for you for social media.
Yes, and I think Tyler is actually driving that. Right?
Yep, sorry.
Okay.
Yes.
Okay.
All right. Can you see the screen?
Looks good.
All right.
Okay. So now that we have kind of discussed and refreshed our memories about, what radon is, how it enters the home, the health effects, which thank you, Christina. I learn something new every time I hear from you guys, and it just fascinates me every time. We wanted to give you guys some tools and resources that would make participating in National Radon Action Month easy, effective, and accurate. Excuse me. So I want to kind of walk you through our online campaign for National Radon Action Month. We get really excited about National Radon Action Month around here. I don't know about you guys. So we wanted to just kind of do the heavy lifting, and there's a lot of information about radon out there. You guys may be aware. We wanted to condense that down and kind of create a week by week campaign in January where we've already matched the images with the facts and the copy, and arranged it in an order that will give people a comprehensive understanding of what radon is by the end of January, National Radon Action Month. So this on your screen is the link to the website that houses all these resources. I'm going to send it in the chat, but you'll also get it in an email after the event, along with this webinar recording in case you'd like to watch it again or share with any of your colleagues or partner organizations. So let's go ahead and dive into this web page together. I'm going to, oh, are you going to share the screen? I think I'll go ahead and share my screen for this part. Here we go. Okay. Okay, so on our website here, it's hard when you have multiple monitors. You're like, what screen is sharing right now? Okay. Are you seeing that?
Not yet.
Okay.
One more share button.
There we go.
Okay, we're here. Thanks, everyone. Okay, so for National Radon Action Month, we have a website here. It's got kind of our little event banner. It says test, fix, save a life. That's kind of our slogan for National Radon Action Month. And we kind of put that at the forefront of our messaging because we just want people to know that it is so easy to test. And in the world where we have a lot of health concerns and problems that we can't fix, it's really encouraging that this one we can fix. The only problem is we have to make sure people know about it. And so we use National Radon Action Month as a month to really get loud about radon and raise awareness. Our really like pie in the sky dream would be that more family care providers talked about radon so that people would be educated about it when they went in for their physical checkups and their annual checkups. Kind of along the same line as when they ask you other healthy habit questions like, you know, do you have lead concerns, lead in paint? Do you test your fire alarms? Do you have a carbon monoxide alarm? We kind of envision it being right up there with that. Yet a lot of families don't know about radon, how it works, or that it even could be a problem in their home. So our goal was to make resources that would be easy for healthcare providers to share. But all the organizations on this call today, I think you'll also find the resources helpful. So please, everyone, feel free to use these, adapt them, edit them, mix and match them. We just want to create resources that are helpful. And we know there's a lot of info out there. So we want to kind of condense it down for you. So before I dive into the social media toolkit, you'll find 3 different ways that you can participate in National Radon Action Month. So besides engaging on social media, we have some printed materials, old-fashioned but very effective, that could be posted in your offices or in doctor's offices, waiting room areas. And then our kind of end goal, like I said, would be to have more doctors talking to patients about radon. And so we have some patient discussion guides as well that could be downloaded, shared with healthcare providers. And we'll talk a little bit more about those at the end of this webinar. Let me first take you through our social media toolkit. This is the next page. You'll see all the resources right here. It looks the same, but down here, you'll see you've landed on our social media toolkit. And basically what we wanted to do was organize a week-by-week campaign for the month of January that was divided into different topics, which are frequently asked questions about radon. So week 1, we start with a general overview of what radon is. And when you click on this banner, it shows you all the post ideas that we have and accompanying images you can use. And so that is kind of the flow of this. Week 2, what is radon? Week 3, how's it enter your home? Week 4, radon is harmful. This goes into the health consequences and effects of radon exposure. So they're kind of divided into different themes. There's a lot of content here. I mean, there's a lot of content about radon in the world, and this is very condensed down, but there's still a lot to share. So if you can only post 1 post from each week, that's amazing. If you only have time to post 1 post the entire month, that's fine too. We kind of have this one and done, all you need to know about radon in 1 paragraph copy that you can use with an image you can use as well. So we wanted to have options, knowing some people might be really excited and want to post all the things. Some people might only have time to post 1 thing. Another option, if you're short on time though, is to go ahead and follow the WCU Environmental Finance Center, our organization, on Facebook, because we're going to be posting all of it in the right order. So if it's easier for you to just follow us and reshare our content when you can totally do that too. So you just have to remember to follow us on social. I'm going to drop our links to our social, Facebook and Instagram in the chat there, so you have them handy. But no matter how you choose to celebrate, make sure you use the hashtag National Radon Action Month so we can keep tabs on it, and just, report back to EPA about all the wonderful radon awareness that's going on in our region. So next I want to show you just how quick and easy it is to post these onto social media, which my banner is totally in the way right now. There we go. So come down, you can peruse this content later or now if you have it open on your webinar, other computer screen. But basically, you're just going to find the post you like, right? Let's say you love this infographic. This is like an all-you-can-eat buffet. You can take what you want and leave what you don't want, or you can have all of it. You can mix and match whatever you want to do. It's yours to adapt. So let's say you're going to go with this one. Love this infographic. Nice, simple post. All you're going to do, and the social media posts are divided into different categories, as you can see. So to use one of these pictures in the post, you're just going to right click on the picture. Are you seeing this, Christina and Stephanie?
Yep, we're good.
Yep.
Thanks. Too many screens. Save it in your favorite folder here. Okay, go ahead and grab the text that you love. Copy it. I'm going to come over here to my Facebook profile and show you guys how beautifully and simple it just copies right over. And I manage way too many social media pages. I'm going to post it on my personal because I'm not quite ready to share it on the EFC's page yet, because I'm going to save that for January. Okay, paste in my copy. Go and grab that photo from your favorite folder on your desktop. A lot of our photos are from the CDC. They have a lot of great graphics. Some of them we made. And then post. And that's it. It will just post a nice, beautiful picture and copy ready for you to share and for your followers. Now, let's say that you are really busy in January and you don't have a lot of time. What you can also do is just go ahead and schedule all these to run in January ahead of time in the back end of your business suite. So if you oversee social media or someone at your team oversees social media, they probably use this Facebook business suite to control content on their page. So what you can do is the same thing. You can just go and add the text, add the photo, and just schedule it to run in the correct month and correct week in January. And that way you are all set. You can just sit back and know that all your posts are going out at the right time. So that is just kind of a how-to on this social media toolkit. We hope you'll take a look at it and see if there's anything there that would be helpful for you guys to share. And my contact information is at the bottom of the page as well, if you have any questions or need help. So real quickly, let me dive into some of our other resources besides the social media toolkit. We have some really great printed materials we created, brochures and posters that can be placed in offices with other health pamphlets and brochures. And the great thing about these is that we have tailored them for every state in our region. So like Christina was mentioning, that radon levels kind of, they're different, state to state on your location. We've actually tailored that information in each of these printed materials. So as you example down here, 1 in 4 Kansas homes have high radon. So it has the state contacts for radon in each of these. So we just want healthcare providers and other organizations that interact with families and the public a lot to know that these resources exist. They're very easy to print, but if you're like, hold on, I love your posters and flyers, but I don't even have time or resources to print them, we've got you covered. You can contact us and we'll actually print them and ship them to you or to a healthcare provider's office. We just want to make it as easy as possible to get this information out to families and to the public, because it is so important for them to just know that it can be fixed and it could save a life. So that is kind of the online resources in a nutshell. Let me just touch on this last resource, which is tailored towards physicians and healthcare providers, but it is our discussion guides for talking to patients about radon. And also some really nice videos on here that just, I think, demonstrate the real demand there is from families that have learned about radon, the demand for this to be more widely available to the public and to people. So I hope you'll check those out. I'll give some links to those in the post training webinar email. But Christina, while we do have a little bit of time, I was going to let you touch a little bit more on any advice you have on these patient discussion guides. And I know that we also had a question from one of our attendees on communicating radon results to families. Could you touch on those two things real quick before we open it up to more Q&A? Okay.
For sure. And since most of the attendees are not medical providers, you can just leave that up there, and we've literally made a dialogue for you so that you can just take the paper, and when you do the provider of medical care does regular, do you have lead in the house? Here's your lead shots for children, also this questionnaire. It is remarkably hard, apparently, to get it into the regular flow of things that the AMA and other people recommend that you talk about in physicians' offices during physicians' appointments, because that has been tried in a couple of states. They've been successful in a couple of states, but it's a much bigger uphill battle than one would assume, given the relatively inexpensive testing, and at least in the schema of house repairs, the relatively inexpensive fix that we're talking about, which I guess we didn't cover. Testing, if you're doing it as a homeowner, is about $15 to $20 for a test kit. It takes 3 or 4 days. Again, ballparks, there's a lot of options out there. Fixing it is about $1,500 to $2,000 nationwide. Closer to $2,000 these days because of labor costs, and also the cost of materials have gone up after COVID and all of those shortages and things. So it's relatively cheap to keep from having $350,000 of lung cancer treatment that you don't survive on average for 5 years. It's a 15% survival rate for lung cancer at the 5-year mark. So this is meant to be easy. It's meant to be able to get in front of folks because it is hard to go through proper channels to get in front of somebody in a doctor's office. So that's the patient action discussion for now. Certainly, if you've got other specific questions, we'd be happy to chat. We put that together for Kansas, actually, 5 or 6 years ago, at the request of the Kansas Cancer Partnership that was working on the cancer plan. But we reached out to the American Lung Association, and so it does have research on it for medical professionals, so that you can see how we find out what the baseline risk for lung cancer is, what is the medical journal article that covers that content. So we do have that level of information for the physician side that goes with this questionnaire, for that reason, so that they can see what they're talking about also. The CDC's got a bigger guide section that has a lot of different information in it. EPA has put together this healthcare professionals guide for your other. So we're going to leave that there for now, unless you have other specific questions, because you all are mainly not healthcare providers, but we want you to be able to recommend these resources to both your own healthcare providers and the others that you may work with, especially if you're in a health department situation. These are things that can be in your lobby or in the rooms for the health department work. As far as communicating your radon results to folks, occupants of a house, or I guess the people who had the test done, because legally the results go to the people who paid for the test, or who are living in the space if you're testing in a sort of program like the folks in St. Louis are doing there. So there's a line that we're trying to walk, right? We want them to understand that this is something that needs to be fixed and has good health benefits if you do fix it. However, we don't actually want them to panic, right? Because this isn't an X amount of radon, then I get lung cancer and then I die equation. It doesn't work like that. This is an increase of baseline risk. And never smokers, with no lung cancer in the family's baseline risk is very low. So that 12% increase over 20 years at 2.7 picocuries means that if you started with a average baseline risk of 2%, after 20 years, your risk is now 2.2%. So it is an increase over baseline. It's not an additional 12% stacked on every time. And that is linear transformation, right? So if you're in a house that tests at 5, you're increasing at 24%. But again, if you start at 2, that means you're at 2.5% after 20 years. So we don't want people to panic. And there are all kinds of additional questions that come around this in the environmental justice space, in that there are no programs in this region that I'm aware of that will help pay for the mitigation. Even though the mitigation is only $2,000, that can be way out of the reach for some folks. It also can be entirely not an option for renters. Anybody who's renting, the state laws don't require that the property owner do any of this work. And so now they're just in a tussle, perhaps. I mean, it depends entirely on their relationship with the property management and then the property owners. Sometimes they're like, sure, do whatever, and we'll just, take it out of your rent, give you a break against your rent to have that work done, but you have to do it, which means they still need to pony up the money. Or if they're an apartment complex, they'll be like, yeah, no, I'm not going to deal with that, which is much more common, right? So we don't have good answers on the environmental justice side of this for folks who perhaps are being tested with your 60 houses there in St. Louis when the results come back high. And so it becomes, in fact, I saw a presentation at the National Radon Symposium in Nashville last month where they were talking about changing the language, and I can let me dig those resources up here from her. That was in Oregon, I think it was the Portland Housing Authority, right? And so they're talking about changing the language so that you're not re-traumatizing people who don't have access to fix it when the results come back high, because the health impact is the health impact regardless of whether they have access. Ooh, you can use a health savings account, some of them. Great information, Leanna. So I don't know if that answers the question. In Radon, all of the questions are wishy-washy and all of the answers are too. So so I don't know if that answers the question the way you would like it to be, but that is the information that we have. And certainly if you have a specific situation you want to chat offline, we can do that too.
Thank you, Christina. So now I'm going to open the floor or the chat to any questions on the toolkit. If you have any questions, please let us know. Okay. Well, if there are no questions, I want to thank you all. Oh, wait, okay. It looks great. Thank you. So, all right. If there's no questions, then I want to thank you all for being here today. And I hope that you find this toolkit very helpful and can get the most out of it that you can. So thank you all.
Anybody have a plan that they want to use? Does anything resonate in particular? Everybody can do one post, yeah?